I think this was one of the best AICOGs which has been held in the last 10 years. Apart from the logistics, we had a very good scientific program, and on first day when we had the workshop, all the halls were overflowing and there were people standing, and the best part was that each session was followed by interaction, and this has really helped in solving the problems of many of the clinicians. And at least the workshop which I was a convener, that is the infertility workshop, after we finished all the sessions, at the end we had an audience interaction which was meant only for 35 minutes, but it went on almost for about 50 minutes. And each and every delegate who had any query regarding the treatment of any of the patients interacted with all the faculty which was there for the workshop. So we had about 15 to 20 faculty on the dais. It covered everything under the roof for obstetrics and gynecology, which included high-risk obstetrics, problems with delivery, it included gynec problems, it also included contraception, infertility, and more so also allied subjects like we had endocrinology, we had neurology, and we had bariatric surgery and other things which are related to the field of obstetrics and gynecology. But I think it could be both ways. It's basically even the patients do not want to take the trouble of going through labor, and many a times patients themselves demand a cesarean section because they don't want to go through the pain of labor. And I don't think on the side of the doctor that they do it for unindicated reasons. Basically today, because of a lifestyle, the pregnancies are more of high risk because there are many problems which are complicating the pregnancy, especially in those women who are PCOS, which is on the rise today. And you can see out of 20, at least 12 women would be having PCOS. And these women basically, when they conceive, they have a very high chance of having gestational diabetes mellitus. Again, because of the age factor, because many women delay their age, and when they come to us at an age which is more than 32 or 35 years, all these pregnancies are basically associated with complications which include pregnancy-induced hypertension, gestational diabetes, you have small for gestational age babies, and all these are high risk. And if they probably deliver normally, there would be complications both in the mother as well as the child. And then probably the obstetrician needs to take a decision that probably a cesarean would be a best optimal treatment protocol, as it would be safe for both the mother and the child. Again, this is lifestyle because we see that they don't have time and so they do not cook, they eat outside. That is one of the causes. Plus, whatever food we get in the market is really having a lot of pesticides, and we have a lot of hormones which are injected both in the vegetarian as well as the non-vegetarian, and this really influences the conception. Second is obesity, which is again a very important factor which is really going to influence the chance of getting pregnant. Third, we have today a lot of women have taken up to smoking, to alcohol, and that again is a very important cause. And the most important cause is that most women today are interested in pursuing their career, and therefore what happens is they do not want to conceive till they are totally settled or till they have reached a particular level of their professional success. And therefore, when they want to conceive after the age of 35 years, we have seen that the chance of conception is less.